Hi everyone, welcome to this short video about iron in pregnancy. Iron is important because it's part of the blood. Specifically, it's part of the red blood cells. Blood transports oxygen and nutrients throughout the body, and it also carries our immune cells. So when we get sick, it's these immune cells that are helping to fight off the disease. Blood supply in the body, it doubles during pregnancy. So it's especially important that women are getting enough iron when they're pregnant. Iron helps to make sure that the growing baby is getting enough oxygen to grow and develop properly, and that also that it's getting all those nutrients from what the mom's eating, that those nutrients are being passed on to the baby. So during pregnancy, the growing baby actually stores iron so that when they're born, they have this iron supply in them. And this supply is enough to last 6 months. So that's why it's really important that when babies first start eating at around 6 months of age, that the foods that they are eating is high in iron. There are two main things that can be done in order to make sure that a pregnant woman is getting enough iron. The first is to take a prenatal multivitamin because this vitamin does contain iron in it. However, there's not enough iron in the vitamin alone to meet the recommendations in pregnancy, and that's because the recommendations in pregnancy for iron are so much higher, and that's because the body essentially needs enough iron to be supporting the growth of a baby and also the well-being of the mom as well. Iron is also in food, the food we eat. So a strategy to make sure you're getting enough iron is to choose foods that are high in iron. And these foods include red meat, such as beef, pork, deer, moose, or elk. Also, fish is higher in iron. Any kind of fish, so walleye, pike, canned fish as well is just as high in iron as the fresh fish. Poultry is high in iron as well. This includes meat from birds, such as chickens, turkeys, geese, ducks, or prairie chickens. So basically, any kind of meat is going to be high in iron. Meat alternatives are also high in iron, and these include any kind of beans, as well as eggs, lentils, chickpeas, or any kind of pulse, really. One advantage to meat alternatives versus meat is meat alternatives tend to be significantly cheaper than meat. One way to get the most out of the iron that we're eating is to pair foods that are high in iron with iron helpers. So every food on this page is high in vitamin C, and vitamin C is considered an iron helper because what it does is it allows the iron to be absorbed better in the body. Basically, vitamin C just makes iron work better, so we're getting the most out of it. So for example, by having like a kiwi or an orange or some strawberries for dessert after a meal, that will help the iron in that meal be absorbed better. Also, tomatoes pair awesome with iron-rich foods. So for example, you're having spaghetti and meat sauce. The meat would have the iron, where that tomato in the tomato sauce would have the iron helpers. The same thing goes like in chilies or soups or stews. By including any food that's high in vitamin C, we're really helping ourselves to get the most out of that iron. Just like there are iron helpers, there are also iron blockers. Iron blockers, they decrease iron absorption. Even if somebody is eating a lot of foods that are high in iron, if they're having these blocker foods at the same time, the iron they're eating is not going to be absorbed well. So the reason that milk is an iron blocker is because of the calcium in it. Now, calcium is still a very important nutrient in pregnancy. It's important for bones and teeth, for keeping them strong during pregnancy and for helping them develop in the baby as well. We just want to be conscious of when we're drinking milk. So ideally, we would not be having milk at the same time as we're having foods that are high in iron. So one suggestion for this would be to have like milk as an afternoon snack, because that way you're still getting the calcium you need, but it's not blocking any iron you might be eating at lunch or dinner. The same thing goes for pop or iced tea or coffee or tea. They are also iron blockers, but they are because of the caffeine in them. So caffeine works the same as calcium. They both block that iron. However, caffeine is not an essential nutrient. It's still okay to have a little bit during pregnancy, but kind of the upper limit that's recommended is 400 milligrams per day. And that works out to be around like 3 to 4 cups of coffee. But when I say cup, I mean like one of those, picture in your head like a 1 cup measuring cup, not like a big coffee mug. It's that little cup that counts as one of those 4 cups. Also, highly processed foods are also considered to be iron blockers. And that's because they are high in sugar and fat and salt, but they don't really have any other nutrients in them for the most part. So if somebody is filling up on these highly processed foods, it means that it's more likely that they're not eating enough iron-rich foods and enough of those iron helpers. So that concludes my presentation today. If you have any questions or comments, please leave them below in the comment box or send us a direct message. You can also get a hold of us at dietitians@pagc.net or at 306-953-7283. And just a friendly reminder that we are doing one-on-one appointments right now. So if you have any questions about your pregnancy, about nutrition that you'd like to talk about, you can contact us to book an appointment. Thanks. See you later.